All employers are required to keep their workplaces safe and healthy, not only for our workers but also for the general public. Let me reiterate that non-compliance with occupational safety and health standards is a crime. Buhay at kalusugan po ng ating mga manggagawa ang nakataya sa pagpapabaya ng mga employers. I'm glad that the Dole family is also here. Employers are required to know from them the extent to which our employers provide information, their workplace is safe and monitor the health not only for our workers but also provide for the general protective equipment. Let me reiterate that non-compliance to our occupational safety and health standards is a crime. We also expect our friends buhay from the Dole ng ating mga manggagawa ang nakataya sa pagpapabaya ng mga for workers whose task can be done remotely to minimize possible spread of the disease. Employers. Ito po ay ilan lamang sa mga the Dole family is also employers are required to know sa DOH the extent to which our employers provide information their workplace safe and monitor the health of their workers. Some specific provide personal issues we would like to raise that, for example, compliance, transmission from asymptomatic person is a reasonable possibility buhay at kalusugan po ng ating mga private sector sa adapt or telecommuting ng mga for workers whose task especially since border checkpoints may minimize possible spread of the disease. Pero po ay ilan lamang sa mga Dole families o yung mga employers marunong sa DOH the extent to which our employers provide information their workplaces safe and monitor the health. Nakakatulong iyon kung asymptomatic nga. Kung pumasok, hindi naman po sila madedetect. Questions like, are we ready? Binanggit kanina ng Senator Nancy. Kung sakaling mag-repatriate na po tayo ng mga OFWs, how are we preparing for that? Kung meron na po, at dasal natin, wag naman sana. If it happens na may Pilipino na po na magkaroon nitong ENCOV, what can we do? Ano ho ba ang economic impact nitong mga nangyayari na ito? Maaaring apektado ang turismo, although we feel na yung domestic tourism ay buhay na buhay pa naman po. Pero alam natin lahat na di hamak na malaki ang nawawala sa atin kung tayo pa ang mamumroblema sa mga dayuhang PUIs. Lalo na kung mahahawa po ang mga manggagawa natin sa mga hotels, restaurants, resorts, airline at airports, transportation at ang general public. Ito pong mga ito ang ating nais pag-usapan at muli, tayo pong lahat ay naririto para makinig, para makiisa, at makatulong. Sa bawat isa po na naririto, lalo na sa mga executives na naririto, maraming salamat po sa inyong presensya. Maraming salamat, Mr. Chairman. God bless us all.
Salamat, Senator Villanueva. Next is Senator Riza Hontiveros.
Salamat, Mr. Chair, at salamat, Sen. Joel. Mr. Chair, I'm in this hearing today not only as a legislator, but as a concerned mother and as a concerned citizen. Bihira lang po ito mangyari, but I do genuinely welcome the President heeding the call to impose a China-wide temporary travel ban. I was one of the first to recommend it. Siguro sa usapin ng public health emergency and preparedness, we should all be on the same side. Ang pangunahing dahilan kung bakit ako nanawagan ng temporary China-wide travel ban, Mr. Chair, is to give time to our local health authorities to properly set up safeguards in our health systems to effectively respond to the 2019 nCoV. Ngayon, nakakalungkot at nakakabahala at the same time na ang pinakaunang namatay sa nCoV sa labas ng China ay nasa Pilipinas. I think this hearing should boil down to one thing. Handa na ba tayo? We don't want our countrymen and women to panic. That's why we have to assure them and answer the most fundamental question. Are we prepared for the worst? At kapag Mr. Chair, kinilala nyo na po ako para makapagtanong, yan po yung patutunguhan ng aking mga tanong. sa ilalim din ng RA 11332 o yung mandatory reporting of notifiable disease na isa po akong co-author na may kinalaman lalong-lalo na sa pagtatalaga ng mga epidemiology and surveillance units o ESUs sa buong bansa natin. Nang sa gayon, kung sakali mang maging malubha pa ang sitwasyon natin dito sa Pilipinas tungkol sa 2019 nCoV, ay tayo nga ay mas tiyak na maging handa, makapagresponde, at magawang ligtas at malusog yung ating mga kababayan. Salamat kaayo, Mr. Chair.
Thank you, Senator Riza. All right, at this point, let me lay down our ground rules for this hearing. To have an orderly discussion, we will allow questions from my fellow senators by order of their arrival. Senator Soto, as our courtesy to our Senate President, to be followed by Senator Binay, Senator Hontiveros, Senator Tolentino, Senator Lacson, Senator De La Rosa, Senator Villanueva, Senator Pangilinan, Senator Drilon. Due to our limited time and to give all senators here a chance to ask, we will only allow 5 minutes per senator to propound questions. Answer of resource persons will not be counted in the 5-minute time limit. Kindly approach the rostrum once it is your turn to ask questions. While we welcome manifestations, recommendations, and criticisms in this hearing, we wish to humbly request that we stick to the most crucial topics that this committee needs to address, namely, number one, the nCoV acute respiratory disease. Number two, precautionary measures the government is taking. Number three, implementation of the travel ban. Number four, repatriation plan. And number five, the tourism and economic impact. The chairman reserves the right to interject questions. With the indulgence of my fellow senators, before our questioning and statements, we shall first hear the presentation of the World Health Organization, followed by the presentation of the Department of Health. Go ahead, Dr. Rabi. You may start your presentation. We'd like to recognize our Senate Majority Leader, Senator Migs Subiri. Go ahead, Dr. Rabi.
Good morning, Chairman Senator Bongo. Thank you for this opportunity. Senate President Vincent Soto, Honorable Senators, Representatives, fellow colleagues from the Filipino government, thank you for this opportunity. Thank you. I will present to you the sequence of how events evolved and the timelines. It's important to understand this, and I will also talk a few things about what we know about this disease. This is a new disease. Many questions are not clear at this point of time. We are working very closely both within the WHO and with international partners to understand this disease better, and we acknowledge the good support we have received from the government of China and its institutions in these efforts. So let me start, and as I go along, I will explain how things evolve. Next slide, please. A very brief update on the number of cases. These were the numbers that were reported to us at WHO yesterday evening. That shows 17,391 cases reported. I like to inform you that the numbers this morning have now risen to 20,438. the vast majority of these cases, in fact 99% of the cases, are within the People's Republic of China and its special administrative regions. Of the 20,000 cases, approximately 2,788 cases are classified as severe disease. The 2019 nCoV acute respiratory disease uh, causes severe disease and can result in death following respiratory and renal failure. However, the number of patients developing severe disease, as you can see, is less than 20% of all confirmed cases. To date, my slide shows 361 deaths reported. To date, we have 427 deaths reported. All of them have been within the People's Republic of China and one death that was reported here from the Philippines. As of today, there are 23 countries that have reported confirmed cases in across the world. Based on this information, the WHO has classified the risk within China as very high and regionally and globally as high. Next slide, please. This shows the timelines of how this situation has evolved. Next slide. On the 30th of December, a cluster of cases of pneumonia of unknown origin was reported in the city of Wuhan in Hubei province, China, to the China National Health Commission. Next slide. This information was conveyed to WHO on the 31st of December, and on the 1st of January 2020, since the cases were concentrated around the Hunan seafood market in Wuhan city, the market was shut down. I want to clarify here that although this is called a seafood wholesale market, what was for sale was not only seafood. There were many exotic meats, among other things, for sale at this market. This is important to understand the following events. Next slide. On the 7th of January, the China National Health Commission informed us that they had isolated a novel coronavirus as the cause of this pneumonia outbreak. I want you to focus on the timelines. This is since the 30th of December to the 7th of January. It's important to realize that within 7 days, the Chinese authorities identified the cause of this outbreak as a coronavirus. This is important because in comparison to the 2003 SARS outbreak, for 1 month, we couldn't isolate the pathogen, right? So this is tremendous progress in regional and global preparedness to deal with an unknown emerging disease. Next slide. On the 11th of January, the first death was reported in Wuhan city. Again, I draw your attention to the fact that till the 11th of January, nobody suspected that this outbreak of pneumonia could cause deaths. This date is important because by the 31st of January, WHO declared this event a public health emergency of international concern within 20 days. Next slide. By the 12th of January, China shared with WHO and globally the whole genome sequence of this new coronavirus. And the virus was formally designated as the 2019 novel coronavirus. Explaining in layman's terms, the whole genome sequence means the molecular structure of this coronavirus. It's important to understand that because this structure helps to develop tests for identifying whether somebody is infected by this virus. Again, I'm stressing the dates. It's only on the 12th that we had with us the whole genome sequence, and based on that, the ability to test for the presence of the virus. Next slide. On the 13th of January already, using that data that China shared, Thailand confirmed the first case of this virus outside of China, but in a traveler coming from Wuhan. Next slide. On the 16th of January, Japan confirmed its first case. Next slide. By the 19th of January, the Republic of Korea reported one case, and for the first time, there was confirmation of cases outside of Wuhan and Hubei province, in Beijing and Guangdong. Next slide. On the 20th of January, there was the first reports of infection in healthcare workers in Wuhan City, China. Again, I draw your attention to the timeline, 20th of January. Until then, the perception was that this disease is caused from a food source, because coronaviruses are normally associated with meat, and the assumption was, because it was concentrated around Wuhan, that people had eaten some meat there. It was only on the 20th of January when health workers at the Wuhan hospital were infected, and this was confirmed, that the first evidence that this could possibly be transmitted from a patient to another person emerged. Important timeline again. This is so much that we didn't know about this disease that is now coming to light. Next slide. On the 24th of January, there were 835 cases reported. The vast majority were within Hubei province. And at this stage, there were isolated cases being confirmed from all of the provinces of China except Tibet. China has 23 provinces. Next slide. On the 30th of January, the WHO Emergency Committee for International Health Regulations, convened by the Director General, declared this a public health emergency of international concern. Due to timeline differences, that happened to be 31st of January, Manila time, because it happened late in the evening in Geneva. Again, it's an important timeline. I want to also explain that the DG summoned the emergency committee for the first time on the 22nd of January to review this incident. And the emergency committee is actually not WHO staff members. It's a committee of global experts that are selected based on the emerging health threat that is being reviewed. And the emergency committee necessarily includes a member from the country affected. That means an expert from China. So on the 22nd, when they met, the evidence available was inadequate for the emergency committee to make a conclusion. And they asked for further evidence, and they reconvened on the 23rd of January. However, At that time, there was no clear evidence to classify this event as a public health emergency of international concern. But recognizing the anxiety and concerns of member states, the DG requested the emergency committee to be available to be reconvened at short notice. And on the 30th of January, they were reconvened and they came to a conclusion that based on increasing numbers of cases within China, increasing numbers of deaths within China, and the presence of cases in several other countries. At that time, I believe it was 12 other countries, including, for the first time, confirmation of person-to-person transmission outside of China in 4 countries: Germany, Japan, Vietnam, and the United States. The emergency committee decided to classify this event as a public health emergency of international concern. At this time, when this was so classified, the outbreak was causing about 25% severe cases and close to 3% deaths. However, and I want again to reiterate this because in comparison to the Middle East respiratory syndrome, which was also caused by a coronavirus, the mortality rate was not 3% as in this case, but 34%. So even though there was low mortality, recognizing the diversity in healthcare capacity across member states and their possible capacity to deal with this outbreak, and also acknowledging the very significant, possibly unprecedented measures being adopted by China to contain the spread of this disease, including a lockdown of a city of nearly 9 million people in Wuhan that has never been done in global public health. WHO decided that it is now time to classify this event as a global public health emergency. And the purpose of this was to ensure that we can contain the spread of this disease and mitigate its impact in other member states. That was the purpose. Reaching this conclusion, the emergency committee and WHO concluded that we still believe that this outbreak can be controlled like the previous 2 coronavirus outbreaks of SARS and MERS-CoV, but that we need to increase the preparedness and response capacities across all member states so that they are prepared to deal with possible importations and the possible emergence of local transmission. This has been our focus not just after the emergence of this outbreak. Since the SARS outbreak, especially in this region of the Western Pacific region where the Philippines and China are both, WHO has been working very closely with member states using the Asia-Pacific Strategy for Emerging Diseases to strengthen country capacities and readiness to deal with these situations. Next slide. Next slide, please. So I want to summarize the impact. Who is affected? Who dies? Next slide. We look at the data. This data is about 3 days old now, but about 70% of cases are among people above 40 years of age. 64% of the cases have been males. About 40% of the cases had some underlying pre-existing medical condition. Oftentimes that was diabetes, high blood pressure, cardiovascular disease, or cancers. Next slide. The deaths. I have revised this based on current data. The death rate now is at 2%. Yeah, so the death rate is now going down because we are testing more people who are less severely affected, who have mild symptoms. And in this scenario, we are seeing that the percentage of deaths is about 2%. 88% of these are in individuals over 60 years of age, with a median age of 75 years and an age range of 48 to 89. I draw your attention to the death here in Manila. The individual was 44 years. 76% of the deaths have been among males, and 70% of them have had pre-existing medical conditions. Next slide. So, based on all of these facts and what is evolving, the risk, as I mentioned, in China has been classified as very high, regionally and globally as high. Next slides. WHO now acknowledges that there is clear evidence of human-to-human transmission. It is important for us to recognize, and I want to explain, that the vast majority of transmission to date is acknowledged to be happening from symptomatic sick people. I am clarifying this because there are lots of reports, and I heard it from Senator Villanueva also, about the concern of asymptomatic transmission. We do have reports from China that this could be transmitted from asymptomatic people. But, and this is not surprising for a coronavirus infection. This was also there during the MERS-CoV outbreak. But we like to clarify that the evidence to date is that more than 90% of the transmission is actually attributed to symptomatic people, right? So that is why we are advocating that people with respiratory symptoms and signs need to be careful, need to practice cough etiquette, need to wear masks, everybody needs to wash hands frequently, because if you're coughing and your droplets contain this coronavirus, it can, the virus could be present on utensils, on home items where an infected person has coughed. Again, I want to reassure you that the evidence suggests that the virus can survive on those surfaces only for a few hours, something between 8 to 10 hours. So if you have somebody sick who is having respiratory symptoms, make sure that you make an effort to clean surfaces that are handled by those people. This is an infection prevention measure, particularly in facilities that we are managing PUIs or confirmed cases until their reports are available. But it's also good practice during flu season to do this. So again, our focus is that by frequent hand washing with soap, if you haven't access to water and soap, to use an alcohol containing sanitizer. I hear your concerns. People have bought up everything on the shelves, but that's another question. What we are advocating is, and WHO has clearly provided and shared information on the use of masks. We don't see a benefit of masks to be used by the general public. we continue to advocate that people who are having respiratory symptoms, people who are dealing with large numbers of public, who are exposed to possible risk, who are in crowded places, could be wearing those masks at that time, but it would be preferable to reserve those masks for high-risk individuals, including health workers. This is important now if we are to prevent secondary transmission, especially from PUIs and in outpatient departments of hospitals. So our message is that we need to be rational about the use of masks. Factually, it shows that non-symptomatic people using masks, it will give them a false sense of confidence and put them at more risk because they tend to wash hands less. So it's more important that they wear the mask properly if they are symptomatic and that they wash hands regularly. Just because you wear a mask, you should not neglect keeping your hands clean. Because if you touch the mask and you have droplets on the outer surface of the mask that somebody else coughed on, you could still get infected. So what is more important is actually hand hygiene, right? Next slide. So we recognize the diverse impact this problem could have on health systems and countries with different levels of socio-economic development and capacities within health systems. I reiterate again, WHO has been working with member states to improve their preparedness and response capacities. I want to mention here that Philippines is one of those countries that have been proactively over the last few years building its response capacities to face such eventualities. Next slide. So, in light of this emerging threat and the evidence that we know about this situation, WHO is continuing to work with the Department of Health and other concerned government and non-government entities in the Philippines to prepare your response capacities and your preparedness capacities, to heighten them based on what is known about this disease. Next slide. A little explanation about a public health emergency of international concern. This is not an easy decision. It has implications. And WHO recognizes that events should not be easily classified as public health emergencies of international concern. The DG explained this very clearly during his press conference and in subsequent communications from headquarters. And this is a very serious recommendation that WHO takes because it provides WHO with the capacity to implement a coordinated response to an extraordinary event that requires a cross-border response through the mobilization of additional resources both within countries and across countries through the participation of international partners and donors. Next slide. So I will summarize the recommendations from the emergency committee that pertains to countries that will help prepare and increase their preparedness. Next slide. So the emergency committee and WHO recommends that countries prepare for containment through strengthening active surveillance, meaning looking for cases, early detection through strengthening laboratory capacities. We commend the Philippines that the Research Institute for Tropical Medicine already has the capacity to test for this virus. Isolation of suspected or persons under investigation and case management. contact tracing and prevention of contacts through isolation of suspected patients and mitigation of the effects of the infection through improved case management. Next slide. The recommendation also places emphasis on reducing human infection, preventing secondary transmission, meaning if you have an infected person, you need to isolate that person so that a second person doesn't get infected, and to prevent further international spread. Next slide. Collaborate and actively participate in increasing knowledge on the virus and the disease. The disease is now classified as 2019 novel coronavirus acute respiratory disease. Next slide. We remind countries that member states are legally required to share information with WHO under the international health regulations about possible cases, confirmed cases, and deaths. This helps WHO to better understand the threat level posed by this situation to individual member states and the global community. Next slide. WHO on the 31st of January did not recommend travel or trade restrictions. However, this recommendation is not binding because countries are sovereign to make decisions based on the travel patterns with the affected country and based on its health system capacities to deal with the possible threat. Next slide. However, we encourage countries to inform WHO of any travel measures taken so that these can be shared with other member states so that they may minimize social and economic disruption. Next slide. So that's the legal basis for that measure. I believe that's all. Next slide. Thank you. So in summation, I want to commend the Department of Health for its leadership and the government of the Philippines for its proactive measures. As I mentioned, WHO announced that this was a public health emergency of international concern on the 31st of January, according to Philippine time, and by the 2nd of February, you had implemented a travel ban, among other measures. Of course, even before this, right from the announcement of the outbreak in China, the Philippine Department of Health, supported by WHO, was strengthening its preparedness and readiness and response capacities. And we continue to work with the Department of Health and the government to prepare their response capacities. We are encouraged by what we have seen. There are still measures that the country is implementing, and WHO stands ready across its 3 levels of country, regional office and headquarters to support those efforts, and we reassure the public in the Philippines to stay calm that the measures being implemented and by the government of the Philippines and recommended by WHO are, we believe, adequate to control this outbreak. Thank you, sir.
Thank you, Dr. Rabi. Let us now hear from Department of Health. Go ahead, Secretary Duque.
Right, Senator Bongo, there on your screens, you're watching the Senate hearing into the novel coronavirus as the Philippines deals with its readiness and response to the quickly spreading virus that has gripped the entire world. The hearing is headed by Committee on Health and is chaired by Senator Bongo. The hearing began with a statement by Senator Go expressing confidence in the work of the DOH, the work that they have done so far. and how health authorities have been working.
Task Force on Emerging Infectious Diseases. And my fellow public servants, isang magandang araw po sa ating lahat. Again, good morning. I'd like my presentation today will cover the following points. First, some information about what the coronaviruses are in general, and in particular the novel coronavirus, which is now briefly referred to as the 2019 nCoV. But if you are attributing the disease to it, it's the correct term is the 2019 nCoV ARD, or the acute respiratory disease. The second part of my presentation would be to highlight the local or the Philippine situation, which is embodied in the timelines of very important events that have so far transpired. And third would be contextualizing the virulence of the 2019 nCoV infection against other coronavirus infections. And it's good to reiterate, even if it's been very clear in the presentation of Dr. Rabia Singhed, the country representative of the WHO in the Philippines. And of course, lastly, I would like to highlight the actions taken by our DOH and our advice to the public. So let me just characterize the coronaviruses first. These refer to a large family of viruses belonging to the family Coronaviridae. And these viruses cause illness ranging from the common cold, which you and I every now and then experience, and to more severe diseases like the Middle East Respiratory Syndrome, or the MERS-CoV, and the severe acute respiratory syndrome, or the SARS-CoV. The 2019 nCoV is a new strain. Coronaviruses are zoonotic, meaning they are transmitted between animals and people, and as confirmed recently, human to human as well. Patients who contract the coronavirus were shown to exhibit respiratory symptoms such as fever, cough, shortness of breath, and breathing difficulties. In more severe cases, the infection can cause pneumonia, as what has happened to the first or the second case of novel coronavirus patient who died in the Philippines. This is an imported case, and I'd like to underscore that this is an imported case. The acute respiratory syndrome and kidney failure are also complications at the extreme end. Again, because the 2019 nCoV is a new strain, there is no vaccine against it, no specific treatment yet, except supportive care. Now, as of February 3, 2020, this have been shown. We can move on. Suffice it to say that the current statistics would show that the case fatality ratio for nCoV has so far gone down from 3% to 2%. That's a good one-third reduction just over the last few weeks. And of course, several other ASEAN countries also have confirmed cases, but WHO, like China, we are considered very high risk for transmission. This in contrast with high risk only for the entire Western Pacific region and the globe. Just to put things in perspective, the case fatality rate of nCoV is much less than SARS-CoV and MERS-CoV. However, it is more easily transmissible, as you can see on the slide. This map shows the distribution of the 80 persons, or rather patients under investigations reported in the Philippines. Note the spike in number of the persons under investigations is attributed in part to the expansion of travel history criteria in our case definition, from those who have traveled to Hubei to include those who have been to China, and the contact tracing activities. The number of reported cases per region are as follows: 3 cases in Ilocos, 1 case in Cagayan, 15 cases in Central Luzon, 27 in Metro Manila, 4 in Mimaropa, 8 in Western Visayas, 11 in Central Visayas, 1 in Eastern Visayas, 5 in Northern Mindanao, and 5 in Davao. Of the 80 PUIs, 67 are currently admitted and isolated, while 10 have been discharged under strict monitoring. Again, 2 mortalities were reported. One is a confirmed case, and the other from a patient under investigation who, however, tested negative and was immunocompromised that gave rise to pneumonia that he eventually succumbed to and died. And the immunocompromised individual, I have to be a bit more blunt about this. Three tests revealed an HIV/AIDS case. In the next few slides, allow me to share the key events surrounding the 2019 nCoV and the Philippines' whole of government response led by the DOH and the task force. Before 2019 ended, as you can see on the screen, WHO observed a clustering of pneumonia cases in Wuhan City, China. By January 6, DOH ordered strict checks on incoming travelers. On January 7, China has identified the new type of coronavirus previously not identified in humans. On January 11, the DOH urged the public with a history of travel to China to seek immediate medical consultation. The next day, the whole genome sequence of this virus was shared by China to the WHO and the public and was designated the 2019 nCoV. On the same day, DOH investigated the report of a 5-year-old case of pneumonia in Cebu City. This is a child who came from Wuhan City together with his mom. On January 17, DOH met with partners to discuss national capacity for 2019 nCoV and reported the 2019 nCoV health events. Thereafter, DOH implemented the mandatory accomplishment. We reinstituted the health declaration cards for all port arrivals because at some points this was stopped. And on January 20, the next slide, the DOH established the 2019 nCoV task force. China reported cases of human-to-human transmission. On January 21, the DOH released health advisories and issued the interim guidelines on the preparedness and response to the CHDs. On January 22, the DOH issued the guidelines for 2019 nCoV response through a department memorandum on strengthening of hospital infection prevention and control measures to prevent the spread of 2019 nCoV. The Chinese authorities locked down the city of Wuhan on January 23. Following this, Philippine airports and seaports were placed on tight watch. The Civil Aeronautics Board indefinitely suspended all operations from Wuhan to the Philippines, while Marina advised ship owners and operators with regard to the nCoV. On January 24, we received the test results of the 5-year-old boy in Cebu and tested negative for 2019 nCoV. On January 27, your DOH coordinated with DFA and discussed foreign concerns relative to the novel coronavirus. On January 28, DOH ups communication of the novel coronavirus by launching the daily case tracker and dedicated website page www.doh.gov.ph/2019nCoV. DOH has likewise announced regular press briefings non-stop with an average of about 30 media interviews and daily, almost daily press briefings which are held for the benefit of the public and to give them the latest updates. On the same day, the DOH convened the first interagency task force meeting on emerging and infectious diseases meeting. Recommendations from the said meeting included voluntary repatriation of Filipinos and travel restrictions for individuals coming from Hubei province. Following this, the Bureau of Immigration suspended visa upon arrival for affected Chinese nationals. On January 29, DOH convened all the CHD directors for a command conference and concerned chiefs of hospitals and directed all DOH units to attend to all persons under investigation and monitoring for 2019 nCoV infection who seek consultation and treatment. On January 30, the DOH confirmed the first 2019 nCoV acute respiratory disease case in the Philippines and initiated contact tracing. LTFRB directed all drivers and conductors of public utility vehicles to wear face masks while on duty. DFA issued a public advisory calling for the voluntary repatriation of Filipinos in Hubei. On January 31st, WHO declared the 2019 nCoV as a public health emergency of international concern. On the same date, the second interagency task force meeting for the management of emerging infectious diseases was held. On a Saturday, the IATF EID operationalized the directive of the chief executive to temporarily ban foreign nationals from China and approve repatriation and quarantine plans for the DOH. On February 2, DOH confirmed the second case of the novel COVID ARD in the Philippines and has reported the first death in the world outside of China. Again, this is an important case of novel coronavirus that succumbed to pneumonia. And February 3, the President has called for an emergency meeting on the 2019 nCoV ARD, which was attended by the DOH and principal members of the IATF EID, Committee on Health, chairpersons of the Senate, Senator Bongo, and the House of Representatives, Congresswoman Tan, and other infectious disease experts, where the President's clear directives were as follows. Number one, to make sure that there will be a regular inventory of isolation rooms, not only in the public sector healthcare facilities, but equally important, the private sector isolation rooms must also be ready. Second is to ensure that there will be a dedicated transport vehicle to ferry patients from the communities, assuming that there is going to be a community spread. But knock on the wood, I hope that doesn't happen. But just the same, we have to be proactive and we have to be indeed ready for that eventuality. And so that is why the President has underscored the importance of a dedicated transport vehicle and not use the other ambulances for transport for fear of contamination. And of course, there has been also highlighting by the President of scaling up the diagnostic capacities, not only of the Research Institute of Tropical Medicine, but last night we have come to an agreement that all the laboratories of our tertiary private hospitals will very quickly be accredited based on stringent standards for the testing of the novel coronavirus. And lastly, the President has also approved in principle the budget of 2.25 billion pesos for the procurement of personnel protective equipment on the assumption that there will be 5,000 healthcare workers who will need this, and there will be 500 or 1,500 pesos. Well, I'll be lost in the computation. I can just give you the computation later. This is going to be on the assumption that this will last for 90 days or 3 months, and they're multiplied by 3 shifts because the care will have to be round the clock, cannot be just for 8 hours. And the total amount would be 2.25 billion plus, of course, 10 million pesos worth of surgical masks. And allow me to just backtrack a little with regard to the PPE. The PPEs will include the headgear, the goggles, the N95 mask, the gloves, the apron, the gowns, which is costed at about 1,500 pesos per set. On the same day, the President reassured the public with transparency that the Philippine government is capable indeed of addressing the 2019 nCoV situation. And this is not the first time, Your Honors, we have been besieged by the similar coronavirus of 2002 and 2003, and as well as the MERS-CoV in 2014 and 2015. So we've done this before, but it is very important that we should be able to heighten all the interventions needed to respond, to mount an effective response to these evolving or emerging infectious disease. And what the challenges are that are observed with this particular novel coronavirus is this particular virus can be notorious for its ability to mutate. And to what extent this virus is going to mutate, nobody knows for sure. And that is why we have to be extra careful. And we ought to be ready at all times. And, uh, and finally, I'd like to just uh, highlight the protection interventions or measures that the DOH has been doing. Even with the confirmation of the first and second cases and PHEIC declaration or global health emergency, our advice to the public remains. Practice frequent hand washing, avoid unprotected contact with farm or wild animals, practice proper cough etiquette, maintain distance of no less than 1 meter, and cover coughs and sneezes with a tissue or the crook of your elbow. Avoid close contact with people showing cold or flu-like symptoms, and ensure that food is well cooked. Travelers with symptoms of respiratory illness, either during or after travel, are urged to seek medical attention immediately. All health facilities are to enhance standard infection prevention and control practices, especially in our emergency triage departments. And we must always be ready, as I have underscored. We sincerely hope that the Senate can help the DOH disseminate accurate information better and support us in our request for a supplemental budget. This is the end of my presentation, and again, pleasant day to one and all.
Thank you, Secretary Duque. Secretary, just one more presentation. I believe Secretary